Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Ainisa binti Muhammad Azhari. I will explain about interpersonal communication. Interpersonal communication involves the information, idea and feeling being exchanged verbally or non-verbally between two people or between two or more people. Face-to-face communication often involves hearing, seeing, feeling body language, physical expression and gesture. In other terms, interpersonal communication is exchanging information, meaning, feeling, and opinion between two or more people via verbal or non-verbal means. Although we mentioned face-to-face communication previously, today's technology compels us to expand its definition to include media social such as phone call and online messaging. Next, I will explain about 8 fundamentals of communication that are commonly discussed. First, clear and concise message. Delivery information in a clear and straightforward manner ensures that the intended meaning is understood. Second, active listening. Active listening to others demonstrates respect, understand, and promote effective communication. That's non-verbal communication. Body language, facial expression, gesture, and tone of voice are all important aspects of non-verbal communication that can convey messages and emotion. Fourth, feedback. Seeking and providing feedback is a constructive manner help to ensure, understand, and confirm the message have been received correctly. Fifth, empathy. Understand and sharing the feeling of others helps to establish rapport, build trust, and exchange communication. 6. Adaptability. Being flexible and adaptable in communication style and approach based on the needs of the situation and the person you are communicating with. 7. Clarity. Using a clear language, avoiding jargon or technical terms, and adapting on your message to the level of understanding of the recipients are essential for effective communication. 8. Respect. Treating others with respect, valuing their opinion and perspective, and creating a safe, inclusive environment for communication encourage open and honest dialogue.
Social and cognitive processes of interpersonal communication. In order to make health communication to be more effective, the communication need to respond to specific social cues and needs. This principle also apply on some types of interpersonal communication such as one-to-one teaching, counseling, personal selling, and provided patient communication. Like I mentioned just now, specific needs including being amused and entertained, relaxing and relieving stress, and appreciating other people. There are also a few factors that affect interpersonal communication, including age and gender, common cultural references, level of intimacy and mutual trust, personal experiences, and lastly, beliefs and attitudes. As conclusion, social and cognitive factors play a key role in how information is being shared, used, or evaluated by individuals. Community dialogue is a process that seeks to create a favorable environment which is communities feel comfortable to express their ideas or opinion or input on some issues which they are consulted. Dialogue is a conversation that takes place at community level which can be formed through a small group of people to a large communities, and it also can be done over internet and other methods. This means dialogues can be made in variety ways that we prefer lah. Community dialogue, also known as an integral component of community mobilization and citizen engagement.
Next, I will present about personal selling and counseling. What is personal selling? It is referred to one-on-one engagement of different groups in their own home, office, or place of work and leisure. Personal selling is also widely used for non-profit causes and to spread the word about recommended new health behaviors and practice. In public health and health communication, personal sellers are usually volunteers, social workers, trainers, health professionals, or representatives of community development organizations who go door to door or attend events where health services are provided. Next, to be a personal selling requires training, but also depend on individual, social, and cultural factors that involve awareness of people needs, strong listening skill, ability to engage the audience and empathy with its perspective, ability to resolve conflict by finding common ground, building trust with the audience by establishing competence. Next is counseling. What is counseling? Counseling is defined as the help provided by professionals on personal, psychological, health, or professional matters that including via one-on-one interaction, personal selling, and other interpersonal communication approach.
Assalamualaikum and hi, my name is Nurul Natasha binti Harnizam. In this part, I will explain about the patient-provider communication. Undoubtful, good communication between medical staff and patient is essential. In addition to improving patient compliance and satisfaction, it also helps to produce better health results. By working with numerous stakeholders to improve communication skills and promote its awareness within healthcare policies and education, communication professionals play a crucial role in enhancing this connection. This may have a considerable positive effect on lowering the morbidity and mortality of chronic disease. Patient-provider communication is the shared and mutually understood exchange of information between the patient and their provider. Without this joint establishment of meaning, patients are at increased risk of adverse events during a medical care. Effective doctor-patient communication is one of the most significant parts of medicine, since it has a huge influence on the outcome of treatment, patient satisfaction, and quality of healthcare. This information are from the article of Berulava, Barriers Effective Communication between Family Physicians and Patient in Georgia. This is from Family Medicine and Primary Care Review. The study showed that the main barriers to doctor-patient communication were limited time during consultation, the excessive amount of information being delivered by the family physicians, patient mispresenting their health problems, insufficient meeting time, inconsistent information being delivered by the patient complying with the treatment strategy, and patient having difficulty understanding the outcome of the diagnosis. So here, I list out of the barriers effective provider patient of commissions, so we can check it out.
Hi and Assalamualaikum. I'm Yuri Azwan Nabila binti Mahat and I will present about priority health and technology mediated. For priority health, in article American Medical Association 2013, racial and ethnic minorities experience a lower quality of health services and are less likely to receive routine medical procedure and have higher rate of morbidity and then no minority. In cross-cultural health communication and emerging core competences in clinical setting, it helps increase focus on health disparities or health equity. And also, many prominent institutions and organizations working to build capacity or tackle health disparity. There are 6 examples of health disparity. Healthcare administrator can help advance health equity by looking at the data. It can help them understand health disparity and who it affects the most. Health disparity include the following. First, mortality. Second, life expectancy. Third, burden of disease. Fourth, mental health. Fifth, uninsured and underinsured. And the last is lack of access to care. Next is technology-mediated communication. What is it? Communication that are controlled and facilitated by technology tools and applications such as telephone conversation, video conferencing, social media, and other mediated communication, including computer-mediated communication (CMC). Technology-mediated communication are influenced by many factors of rural interpersonal communication, such as literacy level, culture, age, gender, and other individual factors. We move to advantage and disadvantage of technology in communication. For advantage, it has speed and time, allow remote communication, mass communication, reduce cost and time, and the last is expansion of coverage area. For disadvantage is privacy issue, overruling culture, distortion from real life, potential for misunderstanding, and the last is loss of the art conversation. And it also technology mediated provide a private forum to discuss sensitivity issue, connect with others with similar health issue, and learn about new medical solution. Okay, that's all from me. Thank you.